Hello, good afternoon and welcome to the first VegfestUK Summerfest Online 2020. Here we are on Saturday, August 15th at just 3 p.m. British summertime. Although it's barely summer out there, it's probably better at British overcast time. But we're thrilled to welcome a global audience here today. And it's a free event, and we've had some really fantastic panels so far today. 3 o'clock till 4:30, we have the live stream here from the Plant-Based Health Professionals UK. And there's a number of presentations available at the event to watch. So there's some fantastic presentations in the Plant-Based Health Professionals UK area of the auditorium. And just to say that this panel, this will be available, this webinar is being recorded. It'll be available tomorrow at the event. And then again for 30 days beyond the closure of the event, you'll be able to pop back, watch the panel, use the resources, and indeed visit our stallholders. So I would ask all of our visitors to do drop by our exhibitors, say hello, do a bit of browsing, maybe a bit of shopping later. So thank you for joining us, thank you for coming, and in particular, of course, thank you to the Plant-Based Health Professionals UK for putting together this panel. And without further ado, I'd like to hand over and introduce, indeed, with some degree of gratitude for putting this panel together, Leila. Thank you for bringing us together.
Thank you, Tim. Thank you for the introduction. Thank you, everybody, for tuning into our panel discussion. As Tim said, my name is Leila. I'm a registered nutritionist, and I'm also an advisory board member of Plant-Based Health Professionals UK. And I'll be hosting today's discussion on health and well-being in the time of Corona. Obviously, coronavirus has been a huge topic over the last few months, and today we have an amazing panel of doctors and nutritionists. And hopefully they can share some useful information, so that you can understand it better and give you tips how to stay healthy. But before we get started, the Plant-Based Health Professionals UK are giving away a copy of Go Vegan by Marlene Watson Tara. So Shireen has the copy. It's an amazing book. It has more than 85 recipes. So all you need to do is to join is post a picture, of this event, of the panel discussion with a sentence or some information you find useful or you enjoy. Post it on social media with the hashtag PBHPUK, and tomorrow Shireen will choose a winner and get the copy to you. So now I'm gonna just let our panelists introduce themselves, and we do that in an alphabetical order. So Alan, you are going to be the first.
Thanks, Leila, for that lovely introduction. Lovely to be here, joining you all on this Saturday afternoon. I'm Dr. Alan Desmond. I'm a consultant gastroenterologist. I work in the NHS. So I actively promote a whole food plant-based diet. The more plant-based, the better, in terms of helping people with the digestive diseases that are so common in the world right now. And earlier this year, my own practice changed quite a lot, as during the spring, I gave up my specialty practice to work for 8 weeks on our local COVID-19 ward, just seeing the impact of this new disease up close and personal. So really glad to be part of the panel this afternoon. Thanks for inviting me.
Thank you. Shireen?
Hi, my name is Shireen Kassam and I'm a consultant haematologist, but today I'm here more in the capacity of being founder and director of Plant-Based Health Professionals UK, and we are a community interest group who advocate and educate on a healthy plant-based diet, so healthy vegan diets for the prevention and treatment of chronic illness.
Thank you. Amaeze?
Hi, my name is Amaeze. I'm a registered clinical nutritionist and I own the nutrition consultancy Life's Recipe. So I focus primarily on pre-diabetes and also now hair nutrition as well. And I'm just recently an advisory board member for the Plant-Based Health Professionals as well.
Thank you. Minil, do you want to say a few words?
Yeah, hi everybody, I'm Minil. I'm a 28-year-old junior doctor from London. Currently I'm working in a district general hospital on the acute medical wards and geriatric wards. I went back to work on the wards when COVID kind of hit. I was teaching at university before that, looking to specialise in general practice with a special interest in lifestyle medicine, sports and nutrition.
Thank you. Jay?
Hi, I'm Dr. LJ Smith. I'm a respiratory consultant in a large South London hospital. My clinical interests are normally lung cancer, COPD and breathlessness. There's been a lot of breathlessness, and certainly I've spent the whole time since March essentially on COVID wards, and then after that seeing patients in our COVID follow-up clinic. And outside of work, I'm interested in social inequality and justice, and I'm part of a number of groups including MedAct, which is currently campaigning on food insecurity, which links very well with other issues around food quality and access. So I'm really pleased to be here to talk today.
Thank you. Simone.
Hi everyone, good afternoon. My name is Simone Venner. I am a registered holistic nutritionist and I work in yoga and meditation too, so a real kind of holistic field to my practice. I work a lot between gut health, lifestyle diseases and anxiety, and yeah, lifestyle and wellness is a big part of my practice, and really happy to be here today.
Thank you. Thank you everybody for the introduction. Now, you know, we have been hearing a lot about COVID-19 and there's a lot of information out there. You know, we always get all these numbers, these statistics in the news. But as you heard, we have actually 3 doctors here with us today who have worked on the front line and they have treated patients with coronavirus. So I'm wondering if you can share with us your experience. LJ, you are a respiratory consultant at King's College Hospital. Do you want to start, you know, telling us about the patients you have treated with coronavirus?
Sure. So it all came quite suddenly back in March, and we kind of turned from being a general respiratory service and seeing lots of general medical patients in our normal cohort of patients into essentially being entirely a COVID service. We admitted a lot of hospitals. We had quite an early peak in London and particularly in South London, and a lot of our population are in some of the risk groups that have been more adversely affected. So we had high numbers of admissions. We had a lot of people who had quite mild illness and we were able to see and discharge quite early, and many of them recovered fully. We've had quite significant numbers of people who were very sick. Some of those we were seeing deteriorate quite quickly and go to intensive care. We set up a respiratory HDU where we could see the sicker patients who weren't going to intensive care but were too sick and required very high levels of oxygen and were seen on the wards. And really the entire hospital transformed, and we had many other colleagues coming to work with us alongside us on our respiratory wards, because really the whole hospital was one big respiratory ward. We have seen a huge drop off in numbers. We haven't really seen new admissions with COVID more recently, which has been great. And so a lot of our work currently is both supporting our patients with chronic lung disease who have lots of ongoing anxiety and concerns about coronavirus. And our practice is quite limited in terms of our normal ways of seeing and supporting people because of all the restrictions on social distancing and people not wanting to travel. And then we've also been seeing people in a very rapidly set up post-COVID pneumonia clinic, trying to assess people's longer term impact of coronavirus. So I've seen a lot of coronavirus and read a lot about it and experienced it both. I think we all have experienced it both as healthcare professionals, but also as individuals in this very strange time.
It is interesting. I mean, you know, you said that you have seen mild form. Obviously, when you work in a hospital, I guess you just see the more severe cases who need admission, right? You don't see, you know, or the other, infections. So I'm just wondering, do you want to say a little bit about, you know, the mild illness that you were referring to, and also the demographic of the patients you saw?
So we've kind of seen different groups of patients. So we've seen patients who've had coronavirus confirmed and have had respiratory and other complications from that. So had respiratory failure and pneumonia, which is very dramatic when seen on imaging. So they're kind of one group. They certainly needed hospital care and many of them needed higher level care. We've had another group of people who are people with other conditions but have been tested positive for coronavirus, but actually weren't particularly sick with that, but we had cases in the hospital where we were having positive cases. And then we've also had people, particularly among our staff, who've had coronavirus but actually haven't been so sick. So although some healthcare workers have certainly been very unwell, and I'm sure many of us will have stories of that, and that has disproportionately affected those who from Black and ethnic minorities, in healthcare workers in particular. Actually, several of my colleagues have had coronavirus and recovered quite quickly. So I think our experience, particularly earlier on, was quite different from the general public's. So we were seeing exactly what was happening and had a slightly more balanced view of the fact that there were mild cases. People just lost a bit of smell, had a fever for a day or two, and then actually felt fine. And then the other extreme, where people were really extremely sick and going to intensive care. So I think seeing the whole spectrum was quite helpful for us to have a better sense of what the illness was. Whereas what's been seen in the media is all of the worst case scenarios and all of the really terrible consequences, which I think has skewed people's view a little and made them extremely fearful. And that's what we're battling now, a lot of anxiety still.
That's quite interesting. I mean, you are in London, so I guess your demographic is going to be different to Alan. You are in Devon, right? So were you working with the patients in that hospital is in Devon, right? So what about the patients you saw and the demographic?
Yeah, Leila, so my experience was obviously quite a bit different to Laura. So I'm down the southwest of England, which, as you probably know, at this point, has the lowest or second lowest death rate due to coronavirus in the UK. But during the very first wave, when this thing really hit us in the spring, I guess my experience very much measured Laura's, in that the first thing I was impressed with was how quickly the NHS staff on the floor, the doctors, the nurses, the physician associates, the carpenters who put new doors up on our ward so people could be isolated, how quickly they all stepped into gear, and really, you know, it was a real groundswell of effort within the NHS right on the front line to get things sorted out. But I think my own personal experience kind of mirrored what we saw perhaps from the UK data, whereby people who came into hospital got pretty sick. 1 in 6 ended up in the intensive care unit. We know nationally 1 in 4 didn't survive their admission to hospital. And we know that almost 80% of people admitted to hospital in the UK due to coronavirus had an underlying chronic disease, such as heart disease, hypertension, hypercholesterolemia, asthma, COPD, etc. And I mean, my experience also was very much of treating people who, like many people in the UK, are living with overweight or obesity, which increases one's risk of hospitalization and sadly predicts your risk of not doing very well or even passing away. My own personal experience is that we converted our gastroenterology ward, which was a standard NHS ward where we would generally have people with Crohn's disease or other severe digestive diseases. And that was converted into one of our hospital's coronavirus wards. So we had 3 wards at the very peak. And the patients I took care of were patients who were already too debilitated by comorbidity to be considered suitable for intensive care unit treatment. So sadly, I spent quite a bit of my time palliating people with comorbidities, and I saw there was a lot in the media, Leila, you know, about how badly hit our nursing and residential homes were. And we've got a lot of nursing and residential homes down here in the southwest of England, and an older population. And a lot of the patients I cared for were older individuals who were coming from that population, and that was very difficult. We had some really heartbreaking cases, including a couple in their 80s who died within a few days of each other on our unit. So some real heartbreaking cases. Yeah.
I mean, you mentioned that 80% of the people who actually were admitted had underlying diseases. So what about those 20%? I mean, was the survival rate, you know, and how they responded to treatment, was it different? Was there a difference?
Yeah, well, we know, I mean, very early on in this pandemic, as we saw the very early data coming out from the Chinese Centers for Disease Control, we had hints already that individuals with hypertension, high cholesterol, heart disease, and these common diseases that a healthy whole food plant-based diet can reduce, prevent, and even reverse, that are so common in the Western world now. Of course, we saw data out of the US just earlier this week showing that, you know, half of all adults in the US have a condition that predisposes them to doing badly if they're infected with Crohn's disease. And 1 in 5 working US adults has more than one chronic disease, the same chronic diseases that predict doing poorly. So yes, sadly, individuals with underlying health problems are more likely to be hospitalized. When they're hospitalized, they're more likely to be ventilated. And when they're ventilated, they're more likely to end up in the intensive care unit. And when they get there, they're more likely to pass away, sadly. So the majority of individuals hospitalized have an underlying chronic disease, what Dr. Burkett, 40 years ago was calling diseases of Western society. So the same diseases that we've known for decades, the same diseases that take years off our lifespan anyway, are the same diseases that seem to be driving individuals into the hospital and into the intensive care unit in the era of coronavirus.
And that is quite interesting. And again, you pointed out something that we all actually believe in, a whole food plant-based diet, which can actually reverse and prevent all these diseases. And obviously, as you say, when you don't have those underlying diseases, your chances are better, your chance of survival, less likely to be, hospitalized. So yeah, we all agree on that. What about you, Minil? Which hospital were you working in at the time? Was it in London or outside? Okay, I think we lost him. Minil?
I've just disconnected. 1 second.
So I was just asking about the difference you saw, which hospital, which was it in London, outside of London, and the demographic?
Yeah, so I was working in a small, like a district general hospital in Luton, the Luton Dunstable Hospital. Funny enough, in February, well, this year I've been actually teaching at King's College Hospital, University, and I got called back to kind of work in hospital in March. And I think just to echo what Alan said about how the NHS mobilised quite early and brought doctors back, and just there was a complete, like you said, a complete upswell in staff, and just to get people on the front line, as everyone's been talking about, and getting more and more doctors there. So we had people it was 24/7. We had multiple doctors per wards to keep it well staffed, because we had such acutely unwell patients. As you know, there is, we operate on a 24/7 service, but there might not be enough doctors around if you have multiple unwell patients. And what we did see was with all wards kind of almost full with patients with coronavirus, you would get patients that were very, very unwell. So we kind of had to be there 24/7. So it would take in shifts 9 hours at a time. So we'd have a morning, a mid-afternoon to midnight shift, and then a night shift. So there was always continuous care. Just going from what I think both Dr. LJ and Alan said about the kind of patients we saw. So I worked in acute medicine for some shifts, but otherwise also geriatric medicine. So I did see a range. We saw young patients with few comorbidities that had been admitted, requiring oxygen, becoming quite unwell. I also saw patients that were on the older age kind of spectrum, above the age of 80, who had multiple comorbidities, and as Dr. Allen pointed out, that often needed to be palliated because there was just not much that could be done for them. Often difficult choices had to be made about who would get to go to ICU and who wouldn't. And it was quite surreal seeing this all kind of unfold in front of you, whereas the world was kind of kept, the media was reporting on what was going on, but unless you were actually there seeing it happen, you wouldn't believe it. It was something out of a movie almost. We heard stories from how it was in Italy and China back in February and January. We didn't know quite what it would be like when it hit here, but it hit here quite hard, and it hit just like it did in Italy. And it was a difficult time to actually be working and seeing it happen.
What I find is interesting is that all of the three of you actually touched on that, is that, how the doctors, and not the doctors, the NHS.
Everyone, nurses, yeah, everyone.
Yeah, and that is something I think we didn't really hear much about it. And it is good to hear that, people who had coronavirus, the patients were actually supported during that time, the support was there. What about, I remember you mentioned that you saw a lot of ethnic minorities. You mentioned that last week to me, the demographic you were seeing. Do you want to talk a little bit about that? And also, maybe the healthcare professionals who were infected and affected by that.
So Luton has a high population, I think, of Pakistani and Bangladeshi people as well. one of the worst affected areas in the UK was Brent, and we know Brent is a very multicultural area as well. I think they had the highest death rate in the UK for any borough. I think it was over 200 per 100,000 population, which when I was looking at the other numbers, I think it was quite staggering. And then also in Luton, we had a lot of Pakistani, Bangladeshi and Indian patients that were admitted with it. It follows that a lot of these individuals also have the comorbidities that we talked about: heart disease, high cholesterol, type 2 diabetes. They might not be often smokers and have COPD, but these ones, mainly heart disease and the type 2 diabetes, you saw a lot more patients with those. And, you know, they were the ones that were often more sick, requiring, you know, oxygen, requiring admission to ITU or HDU as well. So I think there was obviously a disproportional, you know, Black and ethnic minorities have been disproportionately affected by it. I think sadly, even members of staff that were hit by it, we actually lost one nurse who was working one of our wards, and she was actually pregnant as well at the time. And that was widely reported, I think, in the media after her death as well. And she was working in kind of, I think, early March when it just had hit, and she sadly passed away. And I think throughout the UK, most of the doctors and other healthcare professionals that were catching coronavirus and dying from it were people that were from Black and Asian minority groups.
That is really sad. I remember that nurse actually working then, you know, on social media. I saw her picture, and I'm just wondering. We talk about the comorbidities which are present, you know, in 80% of the patients. What about the healthcare professionals? Was it just their ethnicity, or did you actually notice, you know, any comorbidities in them as well? I'm just wondering, was there, you know, any association? Could we actually distinguish something? Could we?
So I would only be speaking anecdotally from the ones I saw that were admitted, and not to go into detail, but they did have, I think, hypertension, you know, borderline cholesterol and things like that. But I think it's just exposure. I think certain members of staff, I think, you know, Filipino members of staff, and, you know, you've got nurses from African descent, you've got more staff that are from those backgrounds being exposed to it as well. So I think it disproportionately affected those people in that way. I think that's my understanding of it anyway.
So it is the exposure mainly, and maybe, you know, the presence of some other illnesses. And it is interesting because the government is actually trying now to look at ways, at measures that kind of prevent a second wave. And, you know, obviously there is no vaccine at the moment, and but the shops, restaurants, you know, all the offices, they are reopening, and people are a bit afraid to go out. And the government is trying to focus on actually getting the nation to lose weight. And I'm just wondering, Shireen, you know, you are also a lifestyle medicine practitioner. So what do you think of the government's, you know, measures? Do you think weight loss is enough, or, you know, what would you recommend?
Yeah, thanks, Leila. A really important topic. And I think the tiny silver lining really has been that as a nation, we're now beginning to focus more on the importance of our personal health and well-being. You know, just on a personal level for myself, my husband has lost 2 stone during lockdown, and guess how? He ate a whole food plant-based diet. You know, no surprises there, but, you know, cutting out the junk, not going out to eat what I eat, and he's lost the weight. And it really, you know, taken something as drastic as this, you know, the risk of being admitted to hospital with coronavirus to get him into action. So I think, you know, he's typical of the British population. We need a bit of fear to get us into action. But I think looking at the government policy, I think obesity is the end result of a systematic problem with our food system. It's a symptom. And as LJ has referred to already, there's so many issues that impact on our personal choice, and access and affordability is key. And I think I was purposely looking at the government, you know, Better Health Weight Loss Plan yesterday. And I think somebody already in the questions has said, you know, all they can find is a low carb diet. And, you know, why can't there be healthy, you know, vegan apps, for example? I think it really isn't clear enough within that information about what foods are truly healthy. You know, there's only a handful of food groups that are associated with good health: fruits, vegetables, whole grains, beans, and then nuts and seeds, and water for thirst. And yet, you know, there's just loads and loads of ideas about how to improve the health of your dish. You know, rather than your pizza being thick crust, go to thin crust is literally one of the things it says on that. And it's like, really, that's not going to be an impactful change to your diet. But I also think it relies far too much on personal responsibility. So somebody is not going to change a lifetime of habits by reading a document that gives you a 12-week plan. And the plan really relies on cutting 500 calories a day. It's a standard approach that we know has failed day after day, year after year, and has not helped us in the long term. So for me, we really have to have a farm to fork approach, which has been written down in policy time and time again. You know, our food system is completely broken. I mean, just thinking about some facts for the UK, and I have to thank my dad, who's hopefully listening into this, for these facts, but 70% of our agricultural land is taken up by farming animals and the food they need for raising animals. 70% of the UK land is taken up for producing meat. And we know that meat produces 18% of calories globally and 30% of protein. And yet we only, in the UK, we only produce 20% of our fruits and vegetables. We've got hectares of land that could be converted into orchards and grow grains and all these sorts of things. And yet we're growing the one thing, animal products, that is destroying our environment, that has created the correct environment for the transmission of pandemics and is contributing to weight gain. So I think until we have a systematic approach that makes healthy foods and vegetables accessible, supportive policies for farmers, supporting individuals to purchase these healthy foods, we're going to fail. And I think that's the sadness, really. And, you know, the government policies are such mixed messages, like the individual in the questions just said, you know, putting a low carb app on. You know, low carb is not a sustainable diet pattern. And then the government are telling us to eat out to help out. And I get that economy is important, but we have to understand that calories eaten outside of the home contribute to our weight gain and our ill health. And so until we provide incentives and education for restaurants to be providing the healthy foods that we need to eat, eating out is just going to contribute to our worsening situation, sadly. And then I heard that the government spent £1 million of taxpayers' money to promote milk consumption during lockdown. Milk consumption, I mean, it's destroying the environment, and dairy is just not necessary in our diet. So overall, I mean, I don't give this policy a great rating. And going back to whether we can offer an app that's vegan, well, I mean, I would love to, and I think it's groups like ours that are going to have to promote this, because the NHS and the government are just not relaying the right message in my view. So I think it's down to us, the people at VegFest, you know, Grounds Root, to really demand this change that is really impacting us all. So anyway, I think that's the end of my hobby horse there.
Thank you for that. And you're right. I mean, you know, fruits, vegetables, whole grains and legumes, so simple. It really sounds so simple. And the government could give incentives actually, you know, for people to go and buy that. I mean, AJ, you mentioned the food insecurity, and this is quite a huge problem in the UK. Do you want to say a bit about that? Food insecurity.
Yeah, I think it's just really important that we continue to talk about the fact that this is a systemic problem, and this is due to, as Shireen has said, this is fork to farm approach. Too often the government, for all health problems and all problems in our society, puts the onus on the individual. You see this as well with environmentalism, and really that is not the way we're going to have long-lasting sustainable change. If you are asking somebody to make changes to their diet, it has to be affordable and accessible. And for too many of the people, certainly that I look after in South London, that's not realistic. We have to be doing much better to provide them with consistent information to ensure that they do have accessible fresh fruit and vegetables, and that they have the skills and the ability to cook those kind of meals. At the moment, people who, you know, there was, you know, a huge increase in food bank use. That was already a shameful problem for our society, which is a rich country, that we have so many people barely able to get enough money together to get meals. We've had a huge increase in that during the lockdown, and sadly we're only likely to see that grow further with the economic impacts of this crisis. So telling people who are just about able to scrape together a few quid that they should spend that on one thing rather than the other, those choices need to be possible for them. They need to be supported. And yeah, I don't think this government's doing enough. And what has been really disappointing recently is to see the National Food Strategy come out, which I had such hopes for, this kind of once in a lifetime possibility of really getting to grips with the food system, and such opportunities for change and to support farmers to switch. You know, we really need to be making this possible for people at every level in the food system, and it just does so little to do that. So I think it's so important that groups like this, who have some power in terms of our privilege, in terms of our voice, because being healthcare professionals, but also all individuals, really demand better from the state, demand better from our policy. Otherwise, it's going to be very difficult to change.
Yeah, that is true. And, you know, as you both said, it is really up to us to, you know, groups like that to get the message out there. And I think really it's about actually giving the message to the people, because they are confused by them, you know, all the mixed messages in the media, by government, and all the other, you know, services out there. And, you know, when you look at the statistics, we know that they're like kind of, you know, Afro-Caribbean, you know, population and the Asian, South Asian communities, the rate of obesity is higher. And they have been more affected by COVID-19. So, you know, we need to come up with policies and information which can actually help those communities. And Amaeze, I'm wondering if you could talk about your Wellness in Color. That is something you recently actually founded, isn't it? Do you want to say a little bit more about that?
Yes, so I started a community called Wellness in Color, and this was started before, this was started maybe in around February or March. And that was just to address the fact that the health messages that are seen, you know, especially within the wellness industry, are very Eurocentric. So they're not very much tailored to suit, you know, Black people and certain ethnic minorities. So there was a space that was needed in terms of, so I'll give an example. The vitamin D recommendation. I think, you know, once the whole coronavirus and vitamin D thing came out, everybody was rushing to get vitamin D. But the general advice on vitamin D in terms of sun exposure is around 10 to 15 minutes a day. But that's based on people who have fairer skin, and people who have darker skin need to get around 25 to 45 minutes a day. But that's not something that's widely spoken about or even recommended. So this was just a space for people to feel included in the health and wellness conversation, to feel as though there's some sort of cultural relevancy when it comes to health advice and even food advice as well. You know, there's people who don't know what kimchi and quinoa is. Sometimes they want to know about yams and plantains and things. And this actually stemmed from a talk I gave to a mainly Caribbean community. It was an older community, and it was on diabetes. And it was a generic presentation on we were talking about the Eat Well guide. And I don't know if anyone's seen the Eat Well guide. It has the different sections of certain things to eat. So I gave examples based on the actual Eat Well guide. And one lady said to me, "This doesn't make any sense to me. All the foods that I eat are not here. So does that mean that I need to stop eating all my foods?" And I looked at the presentation and I realized I had to scrap the presentation and just talk based on my cultural experience. And from there, I realized that we are failing certain communities, especially the communities that might need the help the most. So for example, with diabetes, there's a disproportionate cases of Black and ethnic people who have diabetes, yet the information does not fully support them. So that's where it really stemmed from. And yeah, so on Instagram, it's wellness_in_color.
That is amazing. And I think it is so much needed, as you say. You know, the Eat Well guide is actually a very good example, because a lot of time I use it a lot myself. And I remember I saw your post about that, and I thought, she is so right. There are so many foods I never eat myself, and there are foods I eat and it's not there. So if I talk to people from my background and I talk to them about that, they're going to say like kind of, you know, that doesn't match my experience, my culture actually. So it needs to be adjusted. And I think that's a very good thing you're doing. I'm just wondering, is it like kind of, are you giving workshops, or so, you know, what does it entail actually?
So the aim prior to lockdown was workshops. At the moment, it is just basically providing information on the page. There will be workshops and education sessions as well. At the moment, not at the moment, but there will be in the future.
Yeah, that is great, and I think it is really much needed. I know there is like a Black doctor in the US who has actually come up with a new book on dermatology, showing all the skin rashes on a black, you know, dark colored skin. And I think that is so good. I wish I had that when I was still working as a doctor, because it is not the same as you see in the textbooks. You know, you go out there, you see a different color, and you don't know what to do, you know. It's really good. Nice, well done. And, you know, the last like kind of 5 months, we have been in lockdown, and I know from some of the clients I see in the community, they have left maybe their homes only once a month. And some people are really afraid of going back out there. And I think, you know, LJ actually touched on that, and, you know, everybody actually a little bit, that people are actually afraid, anxious, you know, because the media made it into a big, huge, like kind of, you know, don't touch this, don't do this. And, you know, there is some truth to that. But like, you know, the media likes to exaggerate everything, and then it is so difficult to see which is truth, which is half truth, which is false completely. So I'm just wondering, you know, Simone, you have a holistic approach. So what advice would you give to people, you know, how to overcome that fear? And, you know, because you actually teach yoga as well, don't you? So meditation.
Yes, so I've been teaching yoga. I've been practicing yoga since my mid-teens. I had a neighbor who made me a copy of a VHS. I don't even know how to do that, but she made me a copy. And yeah, I was practicing from the age of 15, kind of on and off and on and off. And it's been more so in my adult life that I've appreciated the power of its practice. And not just from a Western perspective of, you know, Lululemon pants and expensive yoga gear, but how I feel after. And similar to when I work with clients in nutrition, the same thing, you know, you're eating certain foods, how does it make you feel after? How does it make you feel 3 hours after? How do you feel in the morning? And for me, when we connect to how things make us feel, if it ends on a positive note, then we're more likely to gravitate back to that. And I've seen, you know, an incline of, yeah, this fear on top of the anxiety people are already dealing with. So I'm seeing it in my nutrition, but also in yoga, where people are coming back. And I think this uncertainty, because especially in the wellness realm and in the meditation realm, and even, you know, to go back to Buddhism, you know, we sit to really connect to what is happening in the now. But in the time of a pandemic, we're almost thinking, oh my gosh, you know, next year, how's it going to be next year or the year after? It's almost like we're trying to wish that time away. So for, you know, people I'm working with, it's giving them that permission to allow themselves to feel what's going on right now. Because I think a lot of the time we are trying to push away what we feel, and we're encouraged that even with little children, you know, we fall over, we hit our knee, and it's like it needs to be kissed better for us to forget about it. And I think sometimes it's okay to be able to sit with what's happening right now and just take it, you know, day by day and see how you feel. And if it is a case of, you know, anxiety is building, speak to people. You know, I've been encouraging people through Zoom. I mean, Zoom is massive now, and people are doing online quizzes and whatever else they're doing, but to connect to people, to call each other, to find out how you're doing. And, you know, if you're new to meditation, just taking a couple of moments to sit in silence. It doesn't have to be cross-legged. You don't have to burn any incense to connect to that, but to be able to just allow yourself to see what's going on for you and to really connect to how you're feeling right now.
And it's also interesting because during the lockdown, what I hear from a lot of clients is that they have actually put on weight. And obviously we eat our feelings, and that doesn't really help, because we know that, you know, especially if you eat ultra processed foods, that is going to affect your mood again. Is that something you have also encountered?
Yes, and I think also, you know, when we're going through a moment of stress, we tap into this reward therapy. You know, this has happened, so I'm going to reward myself with a bottle of wine or a takeaway or whatever it is. But you know, some of us may have even had 4 months of rewarding ourselves for what's happening, and who knows, you know, how long this is going to kind of continue going moving forward. So I think it's once again, it's connecting to that, and yes, you know, it's coming from, my practice always is coming from a place of self-love and self-worth, and I always connect to, you know, kind of giving myself what my body needs. And I think one thing that we definitely do that has a massive impact on our mental health is we kind of reward ourselves with food that gives us no benefit. Those treats aren't treats, you know. And I regularly, if my mum is listening, I say this to my mum, I was like, oh, it's just a treat. And I was like, you can call it chocolate, but it's not a treat. Yeah, like having, you know, whole food, plant-based meals, breakfast, whatever it is, when you know that you're nourishing yourself, then in my head I try to switch that with my clients to be like, you know, this is actually treating yourself, but at the same time being kind to yourself and not connecting to that guilt and shame that comes along a lot of the time when we eat certain foods because of the media. And I think, you know, it was mentioned earlier, the conflicting information of, you know, we need to lose weight, we need to support ourselves, and I completely forgot, I can't believe how ignorant I am to this, that you can even get half-price food in KFC and McDonald's between Monday to Wednesday. I can't believe it slipped my mind. I thought, what? And I met a friend yesterday that I hadn't seen for about 10 years. And, you know, our lives are completely different. And he was like, yeah, I bought the whole family, 4 of us, 4 Big Mac meals, and it was £10.50. And I was like, what? It is heartbreaking and confusing. And I think with a pinch of salt, if you're telling people to do one thing and you're also telling them to do something else, then that one thing, they're not going to take that seriously. And I think for me, that's definitely, you know, it's a problem, and we keep seeing it being more and more of a problem. But coming back to how we can support that, I think, yeah, questioning what have you done today that is you being kind to yourself, whether that's healthy foods, whether that's sitting for 5 minutes, whether that's waking up 15 minutes earlier with a book and a cup of tea, like taking that time to nourish yourself in one way or another. And we know when we feel better, we do better, right? You know, when you're feeling more energized, you will go to the store and buy some, you know, beautiful multicolored foods, and you'll look through a recipe book and you'll spend more time cooking and continuing to nourish yourself. So I think it's always a good, that's why I work with my clients, and, you know, say, what have you done today that has been you being kind to yourself? And I think that's always a good thing to have at the back of your mind.
I like that. You know, I think part of the reason why we reward ourselves with food is because we want to have this kind of nice warm feeling, and if we do something else to be kind to ourselves, to be nice to ourselves, then we don't need that food. And I think another problem is now with, you know, we have been in lockdown, so a lot of people are working from home. I mean, I know for myself, you know, I used to deliver workshops, you know, exercise classes. Now I'm not doing that. So I'm just sitting in front of the computer doing workshops. So obviously I'm less active, and that is going to, you know, be true for so many other people. And the gyms are closed. You know, we don't go to work anymore. So even that like 10-minute walk to the tube is not happening anymore. So we are actually less active. And at the same time, we have more time to spend in front of TV, and, you know, we are anxious, we are eating more. So it's a really vicious cycle, and it's not getting any better. And I'm just wondering, you know, Minil, I know you are actually very much into fitness like myself. So how do you think people could actually get you know, that activity level again? How can they get actually the motivation to be active despite that, you know, everything else that's going on?
Yeah. So yeah, gyms being closed, I think everybody was asking me to start, what are you doing? Because the gyms are closed, how are you coping? So home workouts became a thing. I think people were, what I did see was like there was a growth in a community of people that were challenging each other to doing home workouts. And I think a lot of personal trainers then quickly switched on to doing Zoom workouts and online workouts. But I think one thing I did learn from this, that if people are part of a community that motivate one another and can be part of groups that can motivate one another, and they'll stay consistent, and they will work out. So I'm part of an online community that my friend started his own online transformation company, and he's got a group online on Facebook, and everyone in there, you know, would come in every day, checking in with each other, talking about what they did today, and that kind of kept everyone going. Even though gyms were closed, I think everybody in that group was still making progressive gains, and, you know, making good progress. I think I lost about 4.5, 5 kilos during lockdown. Obviously I was working, but at the same time I was, again, not eating any processed junk food. I wasn't going out to eat. I was making everything myself. It was mostly whole food, plant-based. Every now and then I would treat myself, but it wasn't, there wasn't that going out to eat. I was staying active. I think what people need to do is make that time in the day, fix times in the day where they do something. It can be something simple as just walking for an hour every day. You can split it up if you want, half an hour in the morning, half an hour in the evening, but just moving more, eating less. And especially if you're out moving and walking, you're not going to be eating. So that kind of staying active and doing that, you have to make that time, make it a habit. And then once you've done it a few days in a row, it gets easier. A lot of people started doing those 5K challenges as well, and got into running as well. I think when the government said that even though we're on lockdown, you're allowed unlimited exercise, that was it. I saw so many people outside in tracksuits. But I think that needs to be pushed more. I think the government, whilst they're saying, eat out to help out, but I think they do need to push people towards exercising as well, rather than just focusing on the food aspect of it all.
It is so true. And when people exercise, when you do something, some physical activity, it can be anything, running or just a walk. Like Simone said, when you feel better in yourself, you actually, when you go back home, you're not going to go and have that, junk food, that cake. You're going to have something healthy because you feel better about yourself. You have done something nice for yourself. So that is so important. I think that is actually, like you say, this is missing from the government's advice, actually, really, isn't it? The emphasis on exercise. And it's interesting because although I know weight loss is more diet than exercise, but it is necessary for good health. And it is a shame that the government is actually not promoting that more. And yes, that would be something, to focus on. Now we are coming to the end of our discussion. And just before we actually have a look at the questions from the audience, the WHO says that, health is a state of complete physical, mental, and social well-being. And it is not just merely the absence of disease, it's, just being well in yourself. And I just think, we have talked so much about illnesses and diseases. So what is one tip you would give, one action people can go out there and just take, action today? Do you want all of you just to give one tip, one advice? Shall we go in alphabetical order or reverse? Or yeah, alphabetical order. Alan, you're first.
Well, my first tip really, if I'm terrible at rapid fire, let me just say that straight up, okay? But what would my number tip would be to, it's simple. I think Minil hinted towards it there, okay? You don't know how to make yourself fitter and healthier. Pick your 3 fittest, healthiest friends and hang out with them more, virtually or in a social distance manner. Build your community around you. If you're surrounded by people who are unhealthy, who smoke, who perfect Sunday afternoon is sitting in front of the TV, get new friends. That sounds a bit harsh, but spend more time with the people you want to be more like, and it'll happen. It'll just become natural to you. So yeah, bit harsh, but I think it's urgent right now. Something's got to change. The health of the nation's got to change, and maybe that's it. Or tip number 2, go watch all of the Joe Wicks workouts again, starting with number 1.
Thank you. But this is so good. I mean, we are social beings. We need people in our lives, and they have an impact on us. So no, I totally agree. Shireen, what about you?
Well, no surprise, I'm going to stick with the food. And it's really just to remove the noise, remove all the media sensationalized headlines, and stick with the basics. Forget about carbohydrates, proteins, and fats and the combinations, and just eat the food. As we said at the start, fruits, vegetables, whole grains, beans, nuts, and seeds. And if you're basing your diet around that, the combinations don't matter. You'll get everything you need.
Nice, thank you. Yes, don't complicate it. Keep it simple. I agree. Amaeze?
Yes, I think we might not have had time to touch on the mental health aspect, but I think that's really important, especially during this time. And we are essentially creatures of habit. And it seems like the lockdown has kind of made everything just go in disarray. So just try to keep some habits, whether that's even waking up and making your bed so that you leave your bed, maintaining those healthy boundaries. So learning to say no to something and not always take on everything, because so much is being thrown at us at the moment. So just creating a space that's really good for our mental health in this moment.
Yes, thank you. That is very important, mental health. Yes, you're right. We didn't have time to actually touch on that, but very important. Thank you. Minil?
So Alan's taken one of my ones, but anyway, I would say being consistent is everything. So when we're looking at health, when we're looking at making a physical change, a mental change, anything, consistency is everything. So as long as you get on the right track, staying consistent. I think a lot of people fall off when they don't see the results they want to see straight away. Just keep plugging at it, make small changes every day. But the key is stay consistent and find ways that will keep you consistent. If it needs to be making friends that will keep you accountable, do that. If it's hiring a personal trainer, hiring a life coach, whatever can keep you consistent. And before you know it, it will become just so easy for you. It will become how you live your life.
Yes, that's true. It adds up, isn't it? Really good. Thank you. AJ?
I would say my one tip would be don't be paralyzed thinking that the change is too big. Just pick something you can do, and you have more power to change your own situation than you think, and then collectively also we have more power than we realize. So don't be worried about the fact that this future we want of everyone eating healthily and accessibly and healthily and having great health throughout their life is not possible. We can all do something to move towards that. So pick your thing and just really go for it.
Yeah, that's a good one. Thank you. Simone?
Got two things. I'll keep it quick. Be kind to yourself. It's one of the hardest things to do sometimes, but definitely tap into that. And also what I've found with my yoga students, they book in advance. And it gives you a reason to wake up in the morning if you don't necessarily have a particular time to wake up. And you can join me for yoga if you want, but it doesn't have to be yoga, whether it's tennis, whatever you need to do, book in something once a week and it will hold you accountable. Especially if you pay for it, it will hold you even more accountable.
Yes, that's good. Thank you. I really like that, being kind to yourself. We forget about that a lot, actually. Yes, I think that's going to be my takeaway. Be kind to yourself. Thank you so much to everybody. I'm going to have a look at the questions. So somebody's asking, what about the long haul COVID? Does anybody have any, opinion on that? Yeah, go on.
So I think this is a really difficult one, that we're seeing lots of discussion about long COVID, and obviously it means different things to different people. What I would say is that of the people we're seeing in our follow-up clinic, I'm only seeing the ones who've had the most severe respiratory complications, but of those people, the longer lasting symptoms are more fatigue and sleep disturbance rather than respiratory symptoms like breathlessness. And also there's a significant amount of anxiety and depression, and also some people who've even got trauma symptoms. So I think we need to be clear about the fact that just as many diseases, but COVID is kind of an example condition of that, anything that's a systemic problem is going to affect our bodies and our minds in multiple ways. And really what we need to be thinking about is for COVID sufferers, but also for anyone living with any kind of physical insult and then chronic disease, our health systems need to do much more than just treat the immediate problem. And we need a much better health, social and community-based approach to supporting people with health throughout. And that relies on support for diet, exercise, and all these things. And people are coming to our clinic saying, I still feel terrible, make me better. And a lot of what we're talking about is the same things that we've been talking about today, and we talk about with lots of people in terms of transforming their lives into more positive, healthy versions of them, which is about routine and sleep and diet and physical activity. And it really does come down to these things to recover from and then maintain that healthy life for the future. So I think it's really important to really help the people who are suffering from these ongoing symptoms, but also to see it not as just a one-off. This is not people who've had COVID are not the only people suffering like this. This is something we need to think about as more of a system.
Yeah, that's a good one. Yeah, healthy lifestyle. We can all actually, use that. Now, somebody's asking, are there any supplements and vitamins? If you follow a vegan diet, is there anything you would recommend? In terms of corona, or coronavirus? Yeah, anybody?
I guess it's the same advice we've been giving for years, right? So if you're on a healthy, whole food, plant-based diet, you're already eating a diet that is less likely to be deficient than a standard Western diet or even a healthy omnivorous diet. in things like fiber and magnesium and folate and niacin and riboflavin and fiber and fiber and fiber. I said fiber 3 times because I'm a gastroenterologist. So, but it's the usual stuff, isn't it? We already touched on vitamin D today, which isn't a vegan issue. It's a modern human living at this latitude issue. But of course, vitamin B12, we talk about this all the time. It's made by soil bacteria. For modern plant-based primates, we need to have our vitamin B12. I know for some reason some people who eat a plant-based diet don't like to take a B12. They view it as admitting failure or a compromise, or you know, but that's fine. But yes, you make sure you're taking your vitamin B12. Make sure you're taking your vitamin D during the winter months, particularly if you can't get exposure during the summertime to all of that sunshine that our body needs. So it's the same basic stuff that we've been saying for years. Unless anybody wants to chirp in on any particular specific super supplement, I think, again, people have been asking us this question, right? I'm sure you've all had this question put to you. What's the one thing I need to do to make myself corona-proof? And it's about social distancing, wearing a mask, sadly, spending less time in groups and less time around other people, and then paying attention to the basics.
Yeah, and I would say, reduce your, intake of processed foods, because the processed foods you eat, the more vitamins and minerals you absorb. Sorry, go on, Amaeze.
To add on that, because there are a lot of people who are out there who are saying that, you need to take this certain vitamin and this certain nutrient, and it's actually about the nutrients that we've already got stored inside of us that help us, as opposed to this thing to boost our immune system. You can't really boost your immune system. So I think it's just about unlearning that and unlearning, there's no specific, even with the whole vitamin D and the link to respiratory issues, it's like vitamin D alone is not going to be your cure. And vitamin C alone is not going to be your cure as well. So just really unlearning some of the things that were being shown on social media and things like that.
Yeah.
I like that. There is no magic cure. There is no magic pill. It's the whole foods. And as Shireen was saying earlier, eat whole foods, whole plant foods. And that is it. Just one last question. There are so many healthcare professionals here. How can I discuss, a plant-based diet with my, doctor? They're always dismissive. So any advice?
Well, tell them about Plant-Based Health Professionals UK and all our resources. And it is getting mainstream. I mean, if your GP doesn't know already that the Royal College of GPs has a Green Impact campaign, and in that Green Impact campaign, it says that GP practices need to teach their patients and their staff about a whole food plant-based diet, and they recommend the course that many of us have contributed to through Winchester University that myself and Leila facilitate on whole food plant-based diet. So it's right in there, and I think we just have to point our healthcare professionals to the array of resources, and so know where to find the information. Most of it signposted on our website on plantbasedhealthprofessionals.com, and tell them to go and read the information. And if you have the means or capacity to do so, then there are plenty of plant-based health professionals, you're looking at them all now, that can support you with a healthy plant-based diet. And actually, when you look at the NHS website, there's very nice information about vegan and vegetarian diets. So I think you just need to send your GP practice or your GP nurse some links to the already, established information out there. And we will continue to try and educate the healthcare practitioners within the UK.
I would just add to that we see this a lot with different things. So the classic example of this is with the tobacco industry, that actually for a long time the data was available and some of it was suppressed, and there was a lot of industry work going on to make sure that the truth didn't get out, and that a lot of the evidence was suppressed. And actually it took healthcare professionals quite a long time to understand and to stop advertising cigarettes. So this is a process that we're on. The change is in the right direction, and there are plenty of us who realise that the evidence is there and continue to show it. So we all owe a responsibility to our patients to inform ourselves properly and to keep spreading the word. So it's going to continue, but we're part of a growing movement. So there should be more voices joining us every day.
Can I just add another rather shocking thing that I found out, that actually that the dairy campaign that run by the government was in partnership with the charity Mind that promote mental health wellness. So I don't know how that happened, but clearly the dairy industry are giving the charity money and they are then promoting dairy. And so you really need to follow the money. And, you know, I think as healthcare professionals, we sometimes have an arrogance that we know it all and we don't want to go to the source data because we somehow think we know it. And we've all come to the realization quite late in our careers, probably, but the information is out there. And as I say, follow the money and you'll soon realize why the truth is being hidden.
Yes.
And just on a note of optimism to that, Shireen, that you're all aware of course, this week, the American Medical Association has written to the USDA strongly suggesting that the new US dietary guidelines are clear that meat and dairy are optional sources of protein on a healthy diet, and that in fact a healthy diet may be better without them. So with talk about mainstream, definitely entering the mainstream.
Yeah, agreed.
Yeah, that is great, and I like that. Yes, meat and dairy, they are optional. They are not a necessity, you know, in our diet. And I think that is a very good. I would actually like to actually end it with that. It's really good. Thank you, Alan. Thank you, everybody, for joining us. Thank you for, giving your time and your expertise. It was really excellent. I'm really grateful. And as Shireen already mentioned, if you need any more information, go to Plant-Based Health Professionals UK. There are lots of videos, and you can send the link to your, doctors. I'm sure they can learn something from it. And we have a chat room, so you can come and, visit us in the chat room and ask more questions. All right. Thank you.
Okay, thanks, everybody. Just before we go, thank you very much for all your information you shared today. It's been really interesting, and especially to hear some of the different perspectives that you bring into the table there. And the plant-based health professionals have been a really major asset to the vegan development recently in the last few years. So particularly Dr. Shireen Kassam, thank you so much, because I know that you've put in a huge amount of work behind the scenes, including a weekly update that's available at 7 AM every Sunday that comes out with a nutrition review that's really valuable. But I was listening in, and I think you've really brought some really interesting, clear messages there that are really helpful, but particularly the basis of, plant-based rainbow healthy diet. I absolutely agree, and having had 40 years now, pretty much plant-based. It's that, basis, those basic steps. And what I do love about what you've been able to do is bridge the gap between the, the scientists and the movers and shakers in the big industry, government departments that rely on information, or we hope rely, or are influenced by the work you do. But then also for the street level, whereby people can access this information in really clear, helpful ways, of which this panel particularly has just demonstrated. So once again, thanks very much. I know you give all your time for free here, and it's really appreciated. You possibly don't always see the gratitude, but I know it's there from especially a number of old school vegans who really, really can see how this is quietly shaping, advocacy. And it's all for the better. So thanks very much. Thank you for those who've been watching, and thank you for those who've been asking questions. As Leila mentioned, there's a chat room function now. You can go and talk to our resident experts here. And you can come back for the next 30 days and access this, because it'll be a recording available as from tomorrow. So once again, thank you very much, and goodbye.